Welcome back to The Gum Guru, your go-to podcast for expert tips and truths about gum health and beyond. Brought to you by North Raleigh Periodontics and Implant Center. I'm Lisa Bruff, your host, and we're here today with Dr. Macon Singletary from North Raleigh Periodontics. Today we're shining a spotlight on oral cancer, a serious health issue that's on the rise. Did you know nearly 46,000 people will be diagnosed this year in the U.S., and sadly someone dies from it every hour. But here's the hope. Early detection saves lives. We'll talk about what oral cancer really is, what causes it, common fears versus facts, and how new technology like oral ID helps catch it early, quickly, and painlessly. So stay with us. All right, Dr. Singletary, can you tell us what exactly is oral cancer and how does it differ from other types of cancer?
Well, oral cancer really, you have squamous cell carcinoma, or that can occur inside the mouth. You have melanoma, that can occur inside the mouth. But it's basically abnormal cells proliferating in a way that that's damaging to the normal function. So you can get osteosarcoma in the jaw. You can have that in your leg. So, I mean, the cancer that occurs in your mouth generally, it can be genetically predetermination. Some people that have a history of throat cancer, the parents had it, they may have a predisposition for it too. But they're environmental things that really cause it more than anything.
Melanoma. You don't think about that as being something that can occur inside of your mouth.
Well, your eye, inside your ear. I mean, places you wouldn't think. But inside the mouth, for Caucasians, freckles inside a Caucasian's mouth is abnormal.
Okay. So if you see a little freckle in there, you
get it checked.
Got to get it checked right away. What are the main causes and risk factors for developing oral cancer? You're kind of starting to say that before.
Yeah.
It's like, what causes that?
Yeah, well, I grew up in Durham. It used to be called City of Tobacco. Now they call it City of Medicine. You got to get politically correct, right?
Right.
But if it wasn't for tobacco, I wouldn't be here. But tobacco is a big one. Tar and nicotine, even vaping. It irritates the oral lining, the alveolar mucosa, the epithelium in the mouth, and chronic irritation is the main cause of cells starting to get funky and do weird things.
Wow. Okay, so it could be anything that kind of, I would have thought vaping. So people probably think they're safe with the vaping, but that's not, that also causes.
Oh, yeah. I mean, it's anything that that God didn't intend for us to put there is going to be a problem. Alcohol, chronic alcohol use. And I said smoking and vaping, but also, smokeless tobacco, snuff or, chewing tobacco. That's a big one. Smoking cigars.
Are there signs or symptoms patients should be aware of? Like when I look in my mouth, what should I be looking for?
So it's a good question. They say irritation doesn't heal in 2 or 3 weeks. Hoarseness, that doesn't resolve. A lump in the floor of the mouth. Swelling in the head and neck region. Now, we're talking about the oral cavity, but your head and neck is a dentist's territory. You can have a lymph node swelling in the floor of the mouth. I don't get too concerned about that. That's inflammation from the head down, sinus and things. But if it's real tender, it should be checked. Your parotid gland, they're
like my one is a little swollen. It gets swollen from time to time.
Yeah, well, and you're reaching along the neck muscle, and any swelling along the neck muscle. I mean, again, that's a dentist periodontist territory because when you do a head and neck exam, we're checking those things. We check the floor of the mouth. We check the muscle of the neck, the sternocleidomastoid. And if there's a lump on the side of the neck, that's not good. That can be lymphoma. And so, I've had an individual that had a lump on his neck, and I said, you got to get that treated. He went in, he was a lawyer in Warrington and very busy. He just didn't have enough time to get checked. And when he did, the primary care doctor, that's a carbuncle. I said, that's not a carbuncle. Go, so he went to Duke, and it was lymphoma, and he passed away from lymphoma.
Wow.
So you don't sit on lumps and bumps that don't heal or are tender. That should be checked. Wounds that don't heal, hoarseness. That doesn't. I've had a little bit of acid reflux, so my voice is a little hoarse. But you want that checked.
Are there some conditions that kind of mimic some of those things that you don't have to worry about? Are there things that if you see, you probably don't have to worry about?
Well, yeah. I mean, again, diagnosing, having somebody put eyes on it and watch it. I mentioned lichen planus.
Right.
Lichen planus is an autoimmune phenomenon that affects the epithelium and how it's tacked down to the connective tissue, and the body reacts against these little, what they call reedy pegs, and it sloughs off. It's initially started by, could be medication or response to an antibiotic that, maybe it irritated the tissue a little bit, and the body said, that we don't like this. And then all of a sudden, it's starting to react against the epithelium, and it sloughs, and there are varying degrees of it. But it will ebb and flow. I mean, there are things that I can prescribe that if a patient comes in and say, I see it, or they complain about it, I put them on some medication, and if it gets better, I'm good. But if it doesn't get better, we biopsy it.
And I know you do those routine big X-rays, like the 360 X-rays and all. Do you check those? Do you check for cancer on those?
Yes.
Do they sometimes turn up under those?
Yeah, you can get bone cancer, osteosarcoma. I had a patient this week that came in and referred by an endodontist, and has a history of trauma. I'm thinking of traumatic bone cyst, but if you do a 3D image, you can see in 3 dimensions what's going on in the bone. And that's why it's so important when x-rays are taken that you get a full set at least every 3 years or so.
Right.
Look, some dentists will just do bite wings in one upper or lower front. That's not enough. You need to see around the root tips because there's pathology that can occur up on the tip of the root that you don't see in the bite wings. And but a 3D image will show it in 3 dimensions. And when I had the 2-dimensional x-ray, I looked at it and said, it looked like it was healing. I did the 3D image, and it was spreading. That kind of concept going from a localized to it's spreading, and it doesn't look circumcised or a delineated border around the if it's diffuse and doesn't look succinct or clear from regular being not dense to dense. And if it's vague, that's not good.
Okay. Wow. Okay. Yeah, you want to make sure you get those. You don't have once every 3. You want to make sure at least once every 3 years.
Yeah, a full set for sure.
A full set with the. Can you tell us about the oral ID? What is it? How does it work? And why is it such a game changer for early detection?
Yeah, the oral ID light is it's a sort of like a UV light, and you have special glasses. And as the light hits the tissue, it should reflect back. If it doesn't reflect back, that means there's increased mitotic activity. And increased mitotic or cell division means there's something abnormal going on. That's cancer.
Oh, wow. But it's really early because it may not be developed yet.
Well, most of the time, we'll do oral ID lights about once a year on patients.
Yeah, I've had those done before at your office. I really didn't know what it was for.
Yeah. And anything that shows up as a dark spot, yes, we catch it early. Sometimes a patient will come in and we see a little red area and they have a history of smoking. Well, if we haven't done the oral ID or if we've done it, we'll take it out and look at it again and see. But there's a characteristic color to the lesion if it's cancer. It's dark. And if it's dark, it needs to be biopsied.
Okay. And how do they biopsy? They send it off to a lab to get that done?
Sometimes I'll do it. It depends on where it's located. You talk about oral cancer. What are in the mouth? What are the danger areas? I mean, cancer can occur anywhere. Lips, like I say, the bone, the cheek mucosa, back of the throat. The most high instance of oral cancer is the oropharynx, the back of the throat, soft palate, and under the tongue. So anything under the tongue that's red, not good.
Okay.
Back of the throat, red that doesn't go away, not good. HPV is an increased rise of throat cancer, and so that's somebody that has the HPV virus. Their susceptibility to throat cancer goes up.
Wow. Okay. So, I think that's kind of what we were going to ask about next. How often should someone get screened for oral cancer, and who should be especially vigilant? Who should be especially worried? Check it more often, maybe.
The patient? Well, first of all, the dentist should be checking every time they see a patient.
Okay.
Every time they're in the chair, they should be looked at. People that are more susceptible are the people who smoke and drink. They're going to have the probability of an increased cancerous lesion in the mouth. Or chronic irritation. Dentures can do it. They don't fit right. Some people just deal with it and it's uncomfortable, but they don't get it fixed. Or chronic irritation in the oral cavity can kick over into cancer. And chronic irritation could be chronic cheek biting. Just constantly chewing on the cheek.
Right.
And then there are things that can irritate it that you eat and could exacerbate it.
Well, that's a good reason for not chewing on the side of your cheek.
Well,
break that nervous habit.
Get your protein elsewhere.
Exactly. What should someone do if they notice something suspicious in their mouth between dental visits?
Get it looked at. Give it, obviously have good oral hygiene. Give it a couple of weeks. If it doesn't go away, get it checked. If it persists. On the lip particularly, we have sun damage on the lip, and if you get you have herpetic lesions on the lip that'll come and go, they'll heal. But if you have a chronic lip scab that doesn't heal, that could be basal cell.
Oh, okay. That's another thing to know. Are there lifestyle changes or habits that people can adopt to reduce their risk? Obviously, don't chew on your cheeks. Don't be drinking too much alcohol. Stop smoking. Stop that chewing tobacco and the vaping. Anything else that?
I think stress always is a factor in overall body health. And how do you handle stress? You exercise, you read, some people, their faith helps them, they lift it up and pray about it. But, it's and just be aware of the things that you eat that can increase inflammatory mediators in your body.
Like hot peppers? I mean, can you still have the hot peppers?
I don't know. They just can irritate things.
Oh, they do. I love those hot peppers.
Processed sugar, processed food, and added sugar is a big no-no. I mean, it can, if you have any potential for cancer, sugar feeds the cancer cells. They go crazy.
Wow. Oh, wow. Okay. Just one more reason for us to not have brownies. Just one more.
That's right. Yeah.
Oh, thank you so much. That was really good. Everybody make sure you get in and get that dental checkup and get those cancer screenings you're supposed to have each time. Well, thank you for turning into the Gum Guru. Remember, oral cancer might sound scary, but knowledge and early detection are your best defenses. If you haven't had your oral cancer screening yet, that's your homework for this week. Make sure you go get that dental checkup and get that oral cancer checked. And ask your dental team about Oral ID, the quick, painless test that can save lives. In the meantime, find your true north of periodontics at North Raleigh Periodontics and Implant Center and visit northraleigh.com to schedule your screening or to learn more. Until next time, keep your smile and your whole mouth healthy.